Iana, you're part of the committee that organized the workshop. What was your expectation on bringing all these experts here to Herrsching? And what do you think is going to come out of this meeting?
Yes, thank you for the question, Elaine. The green space research is not the new field, but it's an emerging issue in environmental epidemiology. And more and more studies coming out, but they are all mainly descriptive. And we do not have much of understanding what the pathways linking green space to health. And this workshop is a platform for experts to discuss what evidence we have on our hands and where should we move further, so which kind of research we need. And the main outcome of the workshop is a workshop report which will be published in the peer-reviewed journal, which will be both the summary and maybe some hints for the future research.
So Terry, during the workshop, we're learning that living in greener environments seems to be good for everything, for reduced mortality. There's studies out there on cardiovascular disease, beneficial effects on certain pregnancy outcomes, as well as mental health. Should we not be a little skeptical about an exposure in a built environment that seems to be able to solve all of our problems?
Well, certainly we have to be skeptical. We almost have a professional responsibility to be skeptical, to really closely examine these kinds of statements. And we know that this kind of exposure, if you will, this engagement with the natural environment or nature, is for some people shadowed with religious tones. And people are very much prepared to believe anything that might be said about how they could be beneficial for health. So we have to be prepared to suspend willingness to go along with popular belief and critically examine some of these claims. At the same time, though, when we talk about the restorative values of contact with nature or nature experience, we can appreciate that we're talking about the reduction of a burden of chronic stress or allostatic load, if you will, that has implications for many different kinds of outcomes. So we're talking about how environmental experience can be health maintaining and promoting by reducing stress or allostatic load, a general concern. So there is plausibility in a variety of ways, biologically and theoretically, in psychological terms.
Thank you for coming. Hi. So my question for you is, have you ever met anyone who prefers to live, or to work for that matter, in a less green environment? So is there any reason really to be doing research on something that seems so obviously good?
Not personally, I would say, but I do know that when deprived people in Glasgow were relocated from inner city slums to new housing estates in the 1950s, that many people chose to take flats with views of other buildings rather than those flats that had views of the woodland that surrounded the estate. And this was because the green space represented a scary, unfamiliar place to them that made them feel isolated, whereas if they could see other dwellings, that was comforting for them, made them feel like they belonged because there was the closeness and the familiarity of having other families around. And this always reminds me that we really need to be thinking about the reasons why some people might not like green space or might not choose to use green space, because this might help us explain why green space seems to have benefits for some people but not for others.
Hi, welcome.
Hello, thanks for having me.
Thank you. So my question for you is related to the dose of exposure or dose of greenness or green space that one needs. So in your opinion, do you have an idea of how much greenness you need in order to obtain a beneficial effect? Is having just a little bit more green exposure than your neighbor sufficient to sort of give you a beneficial effect over them?
Well, I think that it depends on whether we are looking for an exposure-response relationship at population level or level in the individual level. If we are looking for population level relationship, we first need quite a bit of studies with similar designs to pull them using meta-analysis methods. But for individual level exposure, I think it greatly depends on differences between people. Different people have different experiences of nature. So the variation in the effect will be much greater, and the same amount of greenness can bring different benefits for different people depending on their differences.
Hi, Mike. So my question for you is about more of the media aspect. So air pollution has captured the news for years. And there was also a few news stories about noise exposures and other sort of built environment characteristics. So in your opinion, is the greenness research or the hype over greenness in the last few years, is this just a hype, or do you think we are actually onto something new?
Well, I think this is real. Obviously, it's very attractive to people to have an environmental condition that's positive as opposed to things like air pollution and noise, which are always negative. And it's very hard for people to actually think about this all the time. And now we have something where you can actually be optimistic. But I think there's a lot of evidence supporting this research that we're seeing with greenness from environmental psychology, work that's been done in other fields, landscape architecture for many years. So I think it is real. The challenge is really how can we translate this into interventions, into improvements in population health.
So you sound like you are somewhat of a believer, and I know you have a little bit of a rooftop garden in your home. So do you try and expose yourself then to a little bit of greenness every day?
So I don't think it's anything that I actively seek out. It's for whatever reason, I've always surrounded myself with green things, green areas. I will say, though, that having done some of this research over the last several years, I'm much more aware now of green areas around me. So I don't think this has changed my behavior in any way, but I'm very conscious now whenever I'm in a new city, in a new neighborhood, to sort of look around and try and see kind of what vegetation, what natural spaces might exist.
Hi, thanks for joining us.
Thank you.
So my question for you relates to the amount of research that's happened. Recently, in the last decade or so, there's been a boom of research that has come out on the importance of green space and greenness in terms of health, partly because of satellite and GIS availability. Do you think really this is the way we should be going?
Absolutely. This is for sure the way we should be going, because we have a duty. We are scientists, and a lot of our research, we hope, will go into evidence and policy, which is going to influence millions of people's lives. So we owe it to them, and we owe it to the decision makers that we use the best quality data that is available. What we need to ensure then is that there is investment in that data, that it is affordable to everyone and not just to the wealthiest research groups, so that we can all contribute and help make society a fair and healthier place. We all want to try and produce evidence which is robust and accurate, and again, we owe the people we serve a duty to make sure that happens. So this is for sure the way we want it to go.
Hi, welcome.
Welcome. Thank you.
Please sit down. So my question for you is relating to the types of studies that are being designed. So there's a lot of use right now of remote technology and satellite data in order to assign an individual's green exposure. And I'm interested in your view of possibly the importance of other study designs, such as small-scale experimental study designs, or actually going out and sampling an environment around an individual's home.
That's a difficult question. So I would say that perhaps we can definitely use these small-scale study designs, because this gives and provides us with the best accuracy. So I would apply for different scales and maybe several different examples of this very high accuracy, and then trying to learn from this small scale, aim to generate for other populations. So that's basically we can have few small-scale studies trying to generate some rule. And maybe in this case, if I generate for these small studies, I can apply. In that case, I can apply for satellite data, using satellite data studies. But that's a tough question.
Hi, thanks for joining us. So my question for you is relating to some of the research that is being conducted. So much of the previous work that has been done hasn't really looked at why or how people are actually using the green space that might be around their home. The work that you did as part of your PhD tried to get at some of these missing factors using an experimental study design, at least in some parts. And I wanted to ask you, why do you think incorporating these factors may be important?
Okay, so I think that, yeah, it's right that most of the evidence so far has looked at residential exposure to green spaces and health outcomes. And I think that that's interesting to look at, mainly because it's quite easily to translate to policies. But of course, we are missing there the part of if really the people that live closer is using those green spaces more. So when we think about contact, we can look at it asking people if they use the green space or not, or taking objective measures, for example, with the smartphones that can locate them if they are in a green space or not, or with experimental study, going with that people to a green space and seeing what happens to them. And I think that that's also a very interesting part of our research. So with the experimental studies, what is also very cool is that we can look at other health outcomes. For example, most of the evidence look at long-term health effects like mental health or general health status, but with experimental ones we can look more to acute health effects like heart rate variability or blood pressure or cortisol changes that I think are also very interesting and can help us understand better the health effects that we see when we look at residential exposure.
Hi, thanks for joining us.
Nice to meet you.
So my question for you is that there are some studies that show that an individual's perceived greenness around their home, so whether they perceive that they live in a green environment, may be more important or as important as green measures that have been objectively obtained through satellite data, for example. Mm-hmm. First of all, do we believe this? Do you believe this? And should we be incorporating this into our policy planning if perceived may be more important than objective?
Okay, to start with the first question, no, I'm not surprised. I think I believe that perceptions are stronger related to health and well-being than objective green space measures, especially when it comes to subjective well-being measures, because then you have the same source bias, the same person answering a question about the environment and about the health, and some persons are very positively oriented, others negatively, so that will help. But also, if you think, according to some of the mechanisms, the green space works if you use it, if you visit it. And whether you will use it or visit it depends on your impression, your perception of the green space. Do you think it's suited for what you want to do there or not? So no, I'm not surprised that perceptions have a stronger relation than the objective measures of greenness with regard to health and well-being. That being said, how useful are the perceptions? Well, there are two things for research. I think for research they are very useful because they can help you to identify what you should look at in the physical environment. If people say, well, it's too enclosed, so okay, I can change the physical environment. So in that sense, they're very helpful. They direct your attention to what you should measure objectively. But on the other hand, for spatial planning, urban planning, yeah, you change the physical environment. So if there's no relationship between the perception and the physical environment, what should you change then? And the only thing you could do then as a policy person is perhaps just to try to change the perception without changing the physical environment. Then it's more about marketing the existing green space without changing it. You can go that direction, but I think that's not really physical spatial planning anymore.
Morning, Payam.
Morning.
Thank you for joining us here in Herrsching. I have a question for you. So, in your opinion, do you think that we should be trying to add green space and greenness to cities? Or do you think that there might be other elements that policymakers and city planners should be focusing on in order to improve health for all and reduce social inequality in our cities?
There is an accumulative body of evidence, including experimental evidence and observational evidence showing that more greenness and more contact with nature and greener spaces included is associated with improved both physical and mental health and well-being in the urban citizens, for the urban citizens. And this is quite important, and the available evidence is quite substantial, but still we need to know more. We need to know how we need to distribute, let's say, these greener spaces, whether we need to go for one large greener spaces, a few large greener spaces, or a small patches of greener spaces all over the place. What is the per capita required greener space for the urban residents? And these sort of things that we need to sort out in future research. Also, I must say, there are some evidence that greener spaces also are effective to reduce the inequality, especially in health. And with people from the lower social classes benefiting more from greener spaces. Apart from greener spaces, maybe it's not my field to talk, but there are researches about the roles of the active transportation, the roles of other environmental factors, just like air pollution, which is a major environmental stressor in the urban areas, and we can use the greener spaces to partly buffer the effects of those environmental hazards, just like air pollution and noise. So greener spaces is not just about physical activity, it's not just about stress restoration, it's also about reducing the noise, it's also about reducing air pollution and improving air quality. And we are living in an era that it's about also climate change. Climate change is already happening, so greener spaces can have both mitigating effect and also adaptation effects for the occurring climate change.
Hi, Barry.
Hi.
The question I have for you is linked to gentrification. So there have been some concerns by people who suggest that maybe some of the neighborhoods that are being greened or being changed may be pushing out the populations that already live there. So how do you think researchers or policymakers should be approaching the issue of gentrification in policy planning?
I think that's a really good question and a difficult question. We know that greener areas typically have people living in them who are richer and more wealthier and choose to live in those areas. But we also know that the benefits of green space are greater for lower income people. At least that's what the literature suggests now. So I think that it's important to think about that and maybe to consider how do you green a neighborhood to a point that influences health but doesn't induce gentrification and push the poor people out who would benefit the most from that exposure. Also, if you're doing major sort of green space interventions, how do you put in place other policies that ensure that those people don't get pushed out? So I think we see this happening in a lot of different cities, and it's how do we ensure that we can provide a positive public health benefit, but actually reaches the people who need it the most.
Hi, thanks for joining us. So my question for you is, how do you envision this type of green space, greenness on health research to have a societal impact? And do you think that any impact will be possible in the next 5 years?
I think it already has impact on society and on planning. However, what is really necessary is that we really need to better and simplify the results so that it's understood by the public, especially by decision makers. So results are still quite complex, and we need it in very clear and simple words that we can really promote the results to the audience, to the society, and especially to decision makers, so that we can transfer it into planning.
Hi, Mark. Thanks for joining us.
Thanks.
And here in Herrsching.
Great being here.
My first question today it's a broad one. I'd like to ask you, in your opinion, what do you think is the greatest challenges faced by this type of research?
That's a big question. I think there are still many challenges. We know in general that green space is good for us, but the question is how much green space, what type of green space. So what we still don't know exactly, is it what kind of size, number of visits, or the quality of green space that's important. So important challenges are like the assessment of green space, how to better assess it, and how much people get actually as a kind of dose for green space. Furthermore, most of the studies that we've been done are more cross-sectional. I think we need longitudinal studies where we follow up people and see what are the effects. Is there any reverse causation possibility or not, or are there other effects that we don't account for in cross-sectional studies? And then I think there's still quite a few outcomes that haven't been studied, so we can look at different outcomes, important outcomes in daily life and particular health outcomes. Then the question is, also when we create new spaces, new green spaces, what are the health benefits of those and other social and environmental benefits? Still, there are very few studies on this, so we should have more studies on this as well. Where we make a change, do we actually also see positive benefits, is what we see in the current epidemiological studies.
Well, it sounds like there's still a lot of gaps in the green space research that needs to be filled. But actually, there are other types of spaces that are being evaluated. I mean, you just recently got a large project funded to look at the impact of blue space on health. And do you think that this might be a completely independent effects, or is possibly that blue space and green space are really just sort of a natural space health effect?
Yeah. Perhaps it's natural. I don't think we know. And often green spaces and blue spaces go together. Our project in the new Blue Health project, we're trying to separate the blue space effect from the green space effect a bit, but it's not easy to do. There may be similar mechanisms. I mean, perhaps it's just the natural space. I mean, being out there, going out, this whatever goes together with it. We may see a similar effect, or maybe different. We don't know. Again, for blue spaces, we see the studies that have been conducted. We see positive health effects in general, but there are fewer studies than for green space.
I have one last question for you, something we're asking all of our experts. Based on the evidence that we have right now, do we know already enough to start pushing for policymakers and city planners to incorporate greenness and green exposures into their planning? So is it time to start pushing for guidelines, for actual hard recommendations, or are we still sort of at the beginning of this topic and not ready to inform policy?
Oh, that's a difficult one. I know that according to many people, we do not need more research, but usually they are the believers. And there are also many non-believers, and they would like to have more evidence. Personally, I think by now we do have enough evidence to say that there is a clear association. But what we're now looking for is more specifying the relationship and saying something about the dose-response relationship. How much green space do we need to get a certain health effect, and how costly is that to do? Because that's the type of trade-off that has to be made in policies, and that level of detail we know very little about at the moment. So I think more research is needed.
We already have quite a good information on quantitative studies, and we already know that green space is important, what size and what distance we have for the people. However, we would need more information on qualitative features of green space. So which type of green space is best promoting health, or space for activities, for physical activities. This would help us a lot. So there are already some studies, but we need more studies for that.
I think that's something that is quite applicable to most of the research that we do when we look at environmental factors and health, that we tend to think that we have to know exactly what is happening before saying something to policymakers. But I think we can't do that anymore, that we really should try to tell them what we know. And so far I think that the message should be that green spaces are good for people's health, and that they should try to build spaces that can provide the space and the possibility to do physical activity, but also to do social contacts, to talk with other people, and also to relax, to restore, and also to be away from traffic noise. And that they should try to include all the population groups to make sure that both men, women, children, all the people, and all the kind of socioeconomic levels use those green spaces, because so far that's a part of the research, of the evidence, that we are not so sure about what's happening with different population groups.
So in my view, no, we do not have enough evidence on our hands to make any policy recommendations, but we do not have to be detached from policy making. We should collaborate tighter with city planners and ask them what evidence they need, on what data related to which outcomes, and then make more new studies, better studies, and then make guidelines together.
According to my opinion, I think we already have enough evidence showing the great potential of green spaces to improve the health and well-being of the urban citizens. I think we need to have the action now, but we need to sort out more details. I mean, with future studies on how we can do this action, how we can make our parks or green spaces more attractive for people, how they can exert more let's say more services, more ecosystem services to the residents, and also not the human beings, but all other species that are habiting in the urban areas.
I think we know enough to make a start, but as with all things in science, there will never be an end, but we can always try and keep striving to do better.
No, I think that we must have much more data in order to establish guidelines. And I think that's something that we need to develop a methodology and to establish some thresholds. And that will include satellite data, GIS modeling analysis, and more threshold using air photo imagery, and these small-scale studies that we go inside of certain populations relating to your first question. And because this very small located caves provide us with the best accuracy data. And I think that we should expand these small scales, go inside into the detail, from the small scales apply to a large scale data, and then provide some kind of algorithm for these different cases. And studying these different cases, we can perhaps develop a guidelines and a policy how we shall treat and to apply this knowledge. So it's more work need to be done in order to develop a policy research for these vegetative-related studies.
Well, I think it may be the case that it's compelled not on the basis of how much evidence there is, but by political processes where residents insist that they have access to these kinds of places, and they don't want to have to drive out of the city every day to go and find it in some distant forest. But I do think that there is enough evidence now to make clear that this is an important public health concern, that planners, other kinds of environmental designers, decision makers have to pay attention to this. Of course, we can talk about whether evidence is specific enough to guide very specific kinds of design manipulations. There's always going to be more work to be done. Cities are dynamic, and people's understanding, experience of nature is also dynamic. It changes to some extent over.
Well, I'd say no, but we have enough evidence to engage people in more research and to direct the attention of stakeholders and local authorities to the green space field, because we have still methodological issues with exposure indicators, and there aren't a lot of similar studies to pull them. And I bring the question back to the meta-analysis, because policymakers want quantitative estimates of the effect, and to get this dose-response relationship. So I think that we have to standardize the studies that we do.
I think I'm torn. Part of me thinks we might never be ready, might never feel like we have good enough evidence, and maybe the evidence we have at the minute is good enough. But I do feel that we need to do a lot more research into understanding the specifics about the green space and health relationship so that we can inform policymakers, and so that anything that is done to improve human health by using green space doesn't have unintended consequences. So I would say I'd give a note of caution, but say maybe we're there, maybe we're nearly there.
So I think that's a dangerous question, because I think there's always more questions that we can answer, and there's always going to be uncertainty. I think green space, these are fairly early days, at least with green space being looked at from a public health issue and sort of a population scale issue. That being said, at the same time, there's little downside or potential harm that could come from greening neighborhoods. So I think as an option for city planners, I think it's something that they should be considering for health. I think as the research develops, we'll be able to offer, hopefully, more precise guidelines for how to actually green neighborhoods and cities specifically for health. Right now, there's a lot of different options that you can do. You can plant trees, parks, streetscape greenery. We don't really know which ones are most beneficial for health, but the downside of doing that are fairly minimal. So hopefully it'll be a progression, but I hope we don't wait until we have all the answers, because that's going to be a little while.
I think what we know so far, that green space is good. What we see generally when there is more green space, we see more health benefits. I mean, there are also minor risks, what we need to take into account, but in general it's what we see. What we also know that many of our cities, particularly our cities, there's a lack of green space. And the problem is, when there is a lack of green space, you see detrimental effects. So I think we can start saying, make cities greener. Make sure that you have a good green infrastructure, a good network of green space. This is not only about having parks, but also about green trees along the road, and you connect the roads, you connect the parks together to create a green network. So that's important. Also, other things what we see is, for example, kids that go to green schools where there's a lot of green space, they do better than kids that are in grey schools. And in this case as well, we need to look at greening our schools. Too many schools don't have enough green space. So I think we can start. We should start. We should do it well. We also need to make sure that we have good quality green space. But I think in many cases there's a point, there's a case to be made actually for increasing green space, and that's what we should recommend. Green space is good, increase green space, do it in a sensible way, and you get the health benefits from it.
I would say there's actually a lot of work that's going on right now in greening communities that has no basis in research. So what I think that the research should be doing now is actually trying to define in more detail what we mean by healthy green spaces, healthy green areas. I wouldn't say we're at a point where we should be recommending very specific things. That's where we need to be doing more research.